Hello, friends. I'm Dr. Arpana. I'm a practicing homeopathic consultant. I welcome you all to this channel. So, this channel is about health and homeopathy. We talk about the various medical conditions and how can the homeopathic medicines help you. So, if you are new to my channel, before watching the video, do not forget to subscribe to the channel and hit on the bell icon so that you are always updated and you do not miss any information that I share with you all. So, friends, today we will be discussing about the homeopathic medicine Senega. Now, this is also known as Snakewort. So, this medicine has got a very good reputation in treating the respiratory complaints, or we should say, it can act as a very good lung tonic. Now, Senega has the property to produce inflammation, and at the same time, it can help in loosening up the phlegm which is there in the chest, and it can help to expectorate the phlegm. So, Senega will be very much useful in case of asthma. It can be used in both acute and chronic asthma. It can be given in case of chronic bronchitis. It can be given in case of pneumonia, especially when there is pleurisy or what we call as pleurodynia. So, what happens whenever the patient is inspiring, and when there is the process of expiration is taking place, there is a very sharp shooting stitching kind of a pain. So that is the pain of pleurisy. So Senega can definitely help in the symptoms of pleurisy as well. It can be used in cases of emphysema, bronchitis. It is also a very good medicine to be considered when there is some kind of inflammation in the throat and which is having a burning sensation. So there is a burning sensation in the throat. There is a constant scratchy feeling. So the patient will always hem and haw, will always try to clear off the throat, and there is excessive mucus production which the patient would like to clear. So in cases like this also, Senega medicine can be used, and it's a very, very beneficial medicine in case of the excessive phlegm production. When the patient cannot expectorate, the medicine can basically help in the expectoration. It can help in loosening up of the phlegm and help in the expectoration. If there is some burning in the throat, again the medicine Senega can be used and it can be given. So, other than the chest complaints, the Seneca medicine can also be used in case of eye complaint. So, in eye complaint, if there is some kind of paralysis of the eye muscles, so we can give the medicine. It can also be used in the cases of floaters. It's a very good medicine which we should consider in case of blepharitis as well. So we know Senega mostly for the lung complaint, but yes, it is a very good medicine for eye complaints also. But again, it is not a polycrest medicine. So polycrest medicines means that the medicine is basically affecting each and every organ of the body, and it can be used for like multiple complaints. But in case of Senega, it is not so. It is mostly used as an organ medicine, and it is mostly used for the lung complaints, the respiratory complaints, the excessive phlegm production, or when we see there is some kind of oppression in the chest, there is a heavy feeling in the chest. So we can consider the medicine Senega. So, in homeopathy, we give a lot of importance to the modalities of the symptoms. So, here, in case of Senega, we can see that if the patient is like moving, the patient feels better in the cough symptoms. The patient feels better in the symptoms of dyspnea. So, the breathlessness is better when the person is moving, or the cough is better when the patient is moving. When the patient is like sitting or maybe trying to lie down, there is a fear of suffocation. So it feels that something is like oppressing the chest, the patient cannot breathe, and there is a lot of suffocation which the patient can experience. So the modalities, they are also like very, very important, and that is how we differentiate the medicines, and that is how we select the medicines. And so the modalities, or like how the symptoms they aggravate, or how the patient feels better, so that we need to consider in case of homeopathy. And that is the reason when you go to a homeopath, the homeopath will always ask you like how do you feel better, and how do the symptoms they aggravate. So that is because it can help in the selection of the medicine. All right. So, regarding the respiratory complaints, it can also be used for hoarseness. Whenever the patient is speaking, it is difficult for him to speak. So, there will be symptoms of hoarseness, scratchy throat, difficulty in speaking. There is also like a bursting kind of pain while coughing. And there is a very peculiar symptom that the patient feels better when the patient is leaning backward. So the leaning backward will give some kind of relief in the symptoms. There is catarrh production in the larynx. There is loss of voice. There is a very hacking cough. In case of thorax, it feels that the thorax is very narrow. So there is a feeling of suffocation. So the suffocation feeling is coming from the fact that it feels that the thorax is very narrow. Mostly we see that the cough generally ends in a sneeze. So there is coughing and then the coughing will end in a sneeze. There is a lot of rattling in the chest. So in case of rattling of the chest, we have other medications which we can consider like antimonium tartaricum, also known as antimtart, or ipecac. So they are also good medicines which we can consider in case of a lot of rattling of the chest. There is also like dyspnea feeling when the patient is ascending. So the oppressed feeling or the difficulty to breathe, they will increase when the patient is ascending. There is bronchial catarrh. There is soreness of the chest wall. So the whole chest, it feels sore. There is pain. There is so much of mucus, but the patient cannot expectorate. So there is a feeling of soreness. There is a feeling of oppression. There is a feeling of weight in the chest because it is full of phlegm. It is full of mucus, but it cannot be expectorated. So that is the reason there is a feeling of weight. And there is difficulty to raise the cough, there is difficulty to raise the phlegm, and also sometimes we can see that the cough is like ropey in nature because it is like concentrated and the patient cannot take it out, so it can become ropey in nature. So it's a kind of paralytic condition of the lungs. So generally it will be useful in case of old people or maybe young children when the capacity or the lungs capacity that is not enough or that is less, so it can be used in those patients. Also in those who are suffering from long standing asthma, in those cases also we can use this medicine. So old asthma, and when they are having some kind of congestive attack, then we can think about of this medicine. Now, if there is inflammation of the pleura is the lining of the lungs. So, if there is inflammation of the pleura and there is some fluid collection, in that case also the medicine can help. So, it can be used in cases of hydrothorax as well. So it feels that there is a pressure on the chest and it seems as if the lungs, they are forced to the spine, or the lungs, they are forced backwards. So that is the feeling. Because of the fluid collection, there is a feeling that the lungs, that is like pushed towards the spine, or it is pushed backward. So that is how the symptoms like they are coming up because of this paralytic condition. So this medicine can actually help to give some strength to the lungs, and the phlegm and the mucus, they can come out easily with the help of the medicine. So the medicine can be used after pneumonia, or when there is pleurisy, or when there is the lingering on dyspnea feeling. We can use this medicine with great success. For eye complaints also, we can use it. So now, as I said, that it is not a polycrest medicine, and it is like an organ specific medicine. So whenever we are giving organ specific medicines, we give the medicine in lower potencies. So you can give it in 6, or better in mother tincture form or the Q form. So Q represents mother tincture. So Senega Q or Senega mother tincture, like 10 drops of the mother tincture in half cup of water, can be taken 2 to 3 times or 4 times a day, based on the symptoms of the patient, based on the age of the patient, and also the intensity of the symptoms. So that is all about the medicine Senega. And I hope you all enjoyed the video. So do not forget to like, share, comment, and of course subscribe to the channel. Do write me down in the comment section at what all videos you want me to make, so I will be making the videos so that others can also get benefited from homeopathy. And if you are completely new to my channel, so let me tell you that I do have a successfully running Hindi channel as well, and I started with this English channel so that language is not the barrier, and I can reach to as many people as possible with the help of homeopathy. So that is the main aim of this channel. So do help me and support me in this channel, as well as you have shown your support in my previous Hindi channel. So that is all for today. And as I always say, when a healthy mind and a healthy body resides together, diseases disappear. Thank you so much for watching. Thank you.